So my vision for WaSH hinges on a couple of different points. The first is to understand that water and sanitation need to be both embedded and unpacked, and so we can program and think about the two of them both together and separately. So there's a vision for the two of them that separates them out. More specifically, I'm very concerned with the questions of equity and equality, both of access, of condition and opportunity for WaSH, and thinking about different ways to bridge and balance inequities at the global, regional, and national levels. So really finding ways to program and design for WaSH that include addressing inequities across a number of different domains, whether they're economic, cultural, social, political, or environmental.
My personal WaSH vision is mostly relates to my community. Not everyone in my community has access to water, has access to safe water, or sanitation. And so my personal vision for WaSH would be to first make my council, my elected council, my governing body aware of WaSH and all the possibilities and resources that they have to help our community, but as well to make sure that we have every person in our community being able to have safe water and sanitation.
My personal WaSH vision is firstly that all people in the world have basic water and sanitation needs. Their needs have been met. But not only that, it's not just that they have their basic needs met, but that they understand the relationship between water and health and their economic well-being, so that they're motivated to continue to provide themselves with better water and sanitation. And also that we have the public systems in place which promote and support independent action in water, support the ability for people to provide themselves with good water and sanitation, and the systems that will help protect water as a public good.
Well, my personal WaSH vision is really very much linked to safe motherhood, because we know that mothers are really the ones who are usually carrying water. Often when they're pregnant, they're the ones that are going down to get the water, and so really it has a huge impact on their health from a maternal point of view as well too. So I just think the more access women can have, mothers can have to safe water, the safer their lives are as well as for their babies. So I probably come at it from a little bit of a different perspective just because of my obstetrical background.
My vision is really that so much good work is being done across Canada and WaSH, but we need to have a way of all coming together and building off each other's work and really sort of, practically working together versus being competitive.
My personal WaSH vision is very aligned with my organizational WaSH vision, which is a world where everyone has the opportunity to succeed because their basic water and sanitation needs have been met. That no one's ill or sick or cannot go to school simply because they don't have the basic needs of water.
One of the biggest barrier for me, I think, is resources. We have not allocated enough resources. Actually, in most countries, more especially developing countries, we have taken these issues to be a household responsibility rather than taking them to be a country or even a national concern. So in a way, the attention that have been paid to these issues have leave a lot to be desired.
A problem that stems from the top. That is that decision makers and people with the capability to act have access to clean water and sanitation, and as such are not really concerned with that issue.
Some of the biggest barriers is the commitment to building people's local capability and trusting that with the knowledge and skills they will take care of their own water and sanitation. I want to also clarify that when I say the local people, it's at an individual level but also an institutional level, whether it's a municipal government of a small community or a larger community that has the responsibility for their community's water and sanitation and is seeking the skills and knowledge in order to be able to provide that, or it's at a national government scale while they're making plans and strategies for their country. At all of these levels, we have a huge capacity gap to be able to make decisions around water and health, and so we need to be addressing those capacity gaps.
I think two of the big barriers right now are poverty. I mean, just India, for example, there's 400 million people that living on $1.25 a day or less. So poverty is the great challenge, and which is why the Millennium Development Goals of the United Nations are so important. The other challenge is education. A lot of people are not aware of the seriousness of water as a human rights issue. So I think more can be done from the international, national, and NGO community level to promote a dialogue and discussion about water rights.
I guess the motivation. I know I've sat on different political tables and discussed Indigenous and Aboriginal issues, and sometimes it comes down to, you just need to do the right thing. Despite what policy says or regulations or if there's money or the budget doesn't have this or that, sometimes people just have to be able to sit down and say, this is the only thing that we can do. This is the right thing to do. And really disregard some of the other things that are already standing in our way and a lot of times are used to remain as barriers and to slow up progression. So it's really people finally getting to the point where they just say, we have to do the right thing.
Money, political will, but also perhaps a sense of frustration or concern with the complexity, or what we perceive to be the complexity and the size of the problem. Because when we talk about 1 billion people, that's terrifying to have to try to deal with. But the reality is that in many ways, there are strategies or opportunities that we can explore that would give us opportunities and leverage points towards maybe not addressing the concerns of 1 billion people, but a significant portion of them through relatively small, low-cost, easily achieved, easily implementable changes. We don't have to find the giant systemic cure. We can find the easy entry points into that cure.
Well, I think the biggest barrier really is prioritizing it, and it's really the same issue for many of these important foundational health issues. Safe motherhood, access to clean water, it has to really be a priority, and I think people sort of are lulled into a little bit of a sleep and they don't realize how important it is, and certainly here in North America we just don't think of it. I just recently had a colleague here, I brought her from Uganda, and she just couldn't believe that we would drink water from the tap. Versus most Canadians, I mean, they just expect that you can drink water from the tap. So, there's just this huge disparity between access to water in the developed world versus the developing. So, I think the more awareness we can bring about the issue, the more solutions we can come up with.
I think some of the barriers are really the financing, the way things are financed right now. Lots of times international development, the roles and responsibilities of the international and the national players are not clear. So you find international players actually implementing projects in countries, and a lot of the financing for the development is done at a project level, whereas you need financing to develop the institutions and the frameworks in the country so that they can implement, so the local people can implement their own projects. And from my perspective, I think that's the biggest barrier.
For universal access to clean water and sanitation, I think every level has to work together. A lot of things are disjointed when it comes to the way the government departments work and the way that that communities work and the way that organizations work. We all work we're busy doing our little thing, and we're not all sitting down together and looking at universally human beings are family.
I think what we need is a international focus, such as a UN convention on water rights, that would help to galvanize attention, support around the world, and then combine that with stronger partnerships with NGOs and national governments in the developing world, where water poverty is very prevalent in many countries.
I think it takes a huge commitment in terms of building people's capability to take care of their own water and sanitation, and therefore their health.
I think the key way to achieve change is through sensitization. So today we talked a lot about scaling up and scaling out. I think we need to scale up an understanding of the most pressing issues so that people at the top feel that link. Most people at the top, however, only understand questions of votes and money. So how do we get people to pay attention? It's not something I'm too clear about.
We've already talked a lot about the importance of technology and infrastructure and the accessibility, but costs that come with that. But ultimately there are cultural, behavioral, social, and institutional factors that need to be considered. And really there's a question of political will at multiple levels. Communities and individuals have to engage in behavioral change and attitudinal change or motivational change. And we need to think about different ways that we can spark and galvanize or catalyze action, and with lots of different mechanisms, whether it's through social media, through social marketing, through public policy, through distributive policies, as well as finding ways to get people to actually engage with the content, right? To engage with the things that we don't want to talk about.
Well, I think the key really is that everybody in the society is speaking out for. So politicians, journalists, social scientists, religious leaders, educators, that they are speaking out for it and coming up with creative solutions. I think until that happens, until the whole society takes hold of it, you can't just think of it as a health issue. It's not just about medical people advocating for it. It has to be everybody in the society.
What struck me is that we need expertise in that mucky middle, in the in-between top-down approaches and bottom-up approaches. And I think there is expertise around about people that are particularly good at coalition building, people that are particularly good at what some people call knowledge brokering, that kind of thing. I think we need more thinking along that line. So.
I think some of the most important ways are the development of the public institutions and the human capability that we need to get that universal water and sanitation, because we do need the public. Water is a public good, and even the poorest of the poor, they need some way, some education to understand how important it is. And we need those public institutions, the nonprofits, the government institutions, to help provide that education and training, to help for communities so that they can provide their own services, so that the government agencies can provide services at the local and community levels.
I think we need a voice, a joint voice of action, and for all those reasons, I think coming together, collaborating, is going to solve this issue.
I think it would take almost a paradigm shift to say no. The international community is here to empower the locals and and to make them capable and responsible. It would take a paradigm shift to understand that we need to develop the permanent institutions, and not just private sector people are efficient and effective. The public sector people can deliver efficient and effective services, and NGOs are a key part of providing water and sanitation to the poor, and they too need to be financed in a way that is not just project by project, but on a more sustainable basis.
Well, my own vision is quite humble. I mean, I teach at both the U of T and I teach at Kwantlen Polytech University in Vancouver, and also started an NGO called Global Water Rights, which is basically focused on education about water rights and sanitation. And we go out and talk to groups, public groups, academic groups. In fact, I'm going to Thailand in February to do some public lectures on that. So for me, getting the vision actualized is being involved in a grassroots organization like Global Water Rights, and also coming to this important function here by UN University.
Well, I think it's going to take more resources, it's going to take more commitment, and that often comes through real education that resonates with people. People understand the significance of it. Mobile phones are everywhere in East Africa. People want them, they desire them, and they see a purpose for it. And I think the same thing with fresh and clean water and sanitation is when people really see the relevance of it, it makes all the difference.
Harnessing social capital, it's a very big element. It's a very big and very critical element but we have For reasons that I cannot quite articulately explain, we have neglected this component of social capital, and yet if we harness this, resource, it would help to spearhead this and also try to address the issues of resource allocation, more especially in this neoliberal era where there has been more attention, more push towards individualistic or capitalism. So if we can think of more innovative ways like social capital, how do we promote and harness social capital within communities? And also, how do we also, instead of imposing, but how do we work with communities? Because it has always been a very big assumption and a very big bias for many developing agencies to think that they have appropriate solutions to local problems. And in a way, I have always argued that these have been imposing, thinking that what may work in a certain country would necessarily work in a certain country, with ignoring the cultural context, ignoring the knowledge within this country specifics.
It's going to take a lot of talking, a lot of awareness. I really do want to invite some of the WaSH people down to our community. I've talked with them previously, and I'd really like my elected council to hear some of the information that they have, as well as some of the traditional council that we have as well, for them to understand that there are people in this country and in this world that are willing to assist and help us achieve safe water in our community.
I think one important thing that I could do as an educator is to involve my students in a roundtable discussion around what the issues are, to try to help people understand that this is not a problem that's necessarily out there, that problems of sanitation, access to water, and good health are part of a closed circuit, and that the ways that we pollute and the ways we introduce things into the natural environment do have downstream impacts, and so we're all part of a closed loop, and I think we can get the students to talk about that.
My son is a high school teacher in Victoria. He has an Institute for Global Solutions, and the idea there is that my generation has made kind of a mess of some things. Perhaps if we work with high school kids around and give them the chance to work on some of these problems, we'll get some new ideas and fresh energy. He's coming to see me in December. He lives in Victoria. He's coming here to see me. So something I'll do in December is tell him about this meeting and see how some of it could be used for the education of high school kids.
Well, what I am going to do in December is we'll be preparing for our organization's annual learning exchange in January, where all of our staff are back. And so I'll be thinking about how I bring in some of the discussion that happened here into the learning exchange that we have as a team.
Well, I think we're active in my own case in our community. Of course, Vancouver is very lucky and blessed because we have abundance of water and we have an abundance of clean water. So we do not face the health barriers that many communities face, but that doesn't mean that there's not a value in educating. So I think, at least in Vancouver or in Toronto when I'm there, what I can do is to promote education, dialogue, and discussion on this topic.
Well, I think in my community, and I live in East Africa, I think, again, just continuing to keep it as a priority, speaking about it and teaching others and encouraging others to become involved, that's the way it starts.
We're actually looking, very concretely, we're actually looking at bringing together a group of scholars to discuss how sustainability planning can focus on implementation and include water and sanitation issues as part of an implementation problem for rural community development.
Right now, I'm finding, coming to this conference, as I was looking to my staff to find out statistics and information around how many wells do we have that are contaminated, and how many wells do we have altogether in our community? How many people don't have access to clean water? I don't have a database, and that's one of the things that I think I can commit to, is being able to start working on being able to collect that information. And from there, we can go on. I mean, I've got to have facts in order to be able to present to council and then to present to WaSH and to see what can we do in terms of an action plan and getting people to have safe water.
What I'll be doing next week is immediately sharing some of the conversations I've had around mobile technologies back with our Director of Communications, who's developing a pilot around them.
Well, it's interesting you mentioned next week because I lecture as well, and I always include dialogue, and I'm actually doing a lecture next week on human rights of water. So in my immediate week coming up, that's something that I'm going to be focusing on.
I think it's going to be more thinking about this mucky middle expertise. I think I'll probably start making some notes about that and see if we can be a little more explicit from what I've just said today.
Next week, I will work on a neo-functional theory of integration to guide WaSH policy.
Well, I think next week I can do the same in terms of just encouraging local people that I work with and the professionals that, you know what, water and sanitation is a real important priority.